Welcome back to the Health Edition of Talk Television. I'm Omar Sachedina, and we're talking today about hair loss and hair transplants with Dr. Robert Jones from the Toronto Hair Transplant Centre. Perhaps it's a basic question. Why do some people lose hair and not others?
Well, the main reason is that in males is that they have a receptor on the follicles on the top of their head that's sensitive to DHT. And that's genetic, basically. So, and there's actually, about 6 months ago, there was a couple of researchers in Montreal that found the gene that for hair loss. There's two genes, one sex-linked and one regular gene.
So what does that mean for the future of the industry?
Well, they found the gene, but they haven't found the cure yet. So,
okay. Do you think it's that one step is perhaps, I don't know, a cure, but
hard to say. You know, I think I think for a cure, I think what you have to do is clone the follicles that are permanent on the side of the head and put them on the top of the head, so you create new follicles, which hasn't been done yet. And I think, you know, who knows what the future will bring in terms of, but at this point we can actually test for that gene. So in males, and then quite a few females actually have sensitivity to testosterone as well. And so one of the reasons that females get some hair loss, but it's again usually hereditary as well. Their follicles on the top of their head are just sensitive to fall out, that's all.
And just so we're all on the same page, DHT is?
DHT is a byproduct of testosterone. So males, the reason why males lose their hair is that that testosterone is converted by an enzyme to DHT. It's a byproduct. And that actually, that medication that we were talking about earlier, Propecia, stops the conversion, blocks the enzyme, so stops the conversion of testosterone to DHT.
All right, let's get back to the calls. Peter on the line from Cambridge. Hi, Peter.
Hey, how's it going?
I'm doing pretty well. What's your question?
I'm just wondering, I'm 26 and I have, my crown of my head is actually fairly thinned out, and I've always had receding hairlines, but it's gotten worse. I'm just wondering what's the most inexpensive and best solution for me to get that hair back.
Yeah, so 26 years old, pretty young guy. He's experiencing hair loss. Now, what would he do? Would he go for things like Rogaine or Propecia, or would he do the transplant?
If you're in my office for a consultation, the first thing I'd recommend for a 26-year-old is medical treatment, for sure, at age 26. And I would suggest starting on Propecia and trying some minoxidil for a year. Now, not everybody gets dramatic response to medical treatment, but there are probably 1 in 10 get an incredible amount of regrowth. And I always say the only way to find out is to try. And, you know, if you want to call my office, come up for a consultation, it's an easy thing to do. And there is certainly a certain percentage of people that will get regrowth with those medications. And if nothing else, you know you're not going to lose any more hair if you start on those.
How expensive are some of these procedures?
The procedure, the hair transplant,
yeah,
varies in price from about $5,000 to $10,000. The consultations are no charge, though, so I can at least recommend, if people, I can recommend a sort of a treatment plan, and then they can make up their own mind. It definitely, not everybody is a good candidate for a transplant, so I can tell pretty quickly whether you're in that category or what the best treatment for you is.
And the medications, would those be cheaper?
Well, you know, depends. Actually, the Propecia, if it's prescribed as a prostate medication, is usually covered by drug plans. It's about 50 cents a day. The minoxidil that you get over the counter is about 50 bucks a bottle, and a bottle will last you about a month. I have a 6% solution at my office that I sell to patients, and it's also, you can, probably about a bottle a month as well that you need to use.
What are the side effects?
Propecia just has one side effect in 1% of males is difficulty getting an erection, which is unfortunate, but it's completely reversible if you stop it. Okay. So basically, if you stop it on Tuesday, by Wednesday, you're fine. So it's fairly quick, short. If you do have a problem with it, I probably get a couple of guys a year that have to stop it. The minoxidil, about the only side effect that I've ever had to stop patients using it is skin irritation. And it's usually from the base. There's an alcohol base in it, so it does cause occasionally cause some irritation of the skin.
So some medications could possibly be covered. As far as transplants go, are those covered as well?
The only people that get their transplants covered are people with significant hair loss from medical problems. And an example is I had a fellow in just a few weeks, or actually I've done a couple of transplants on, that fell into a fire about 2 or 3 years ago, and he had terrible burns on the side of his face, and his whole brow was burned off. And we were able to manage to completely restore his sideburn as well as his eyebrow. Pictures are on the front page of my site, and it was very exciting. This fellow was such a nice fellow, and that would be no charge at all to the patient in that sort of circumstance.
Carla on the line from Toronto. Hi, Carla.
Oh, hi there. Good afternoon.
Good afternoon.
Yes, I have a problem with my hair for already a long time. I'm 26 years old.
Okay.
And my hair is falling since the age of 20. And it's losing, like, every morning when I cut my hair, a lot come off. And I'm just wondering why it's happening, because I do have a healthy diet, and it's not because of my pregnancy, because I already have 2 kids. The first one is 10, the other one is 13 months, and my hair has been falling since the age of 20, and I'm just wondering why is that happening to me.
And Carla, have you tried anything else to try to correct that?
Yes, I did. I tried minoxidil, whatever. I think it's what's called.
Yeah, minoxidil.
Yeah, and I didn't get good results off of it. I tried for 6 months. I didn't see nothing working. I tried other medication. I just don't know the top of my head the name, and did not work out. So just wondering if it's because of inside, maybe something inside of me is not treating. I'm not sure.
So that's got to be frustrating. I mean, she's experiencing this, and she's tried minoxidil.
At age 26, Carla, it's a huge problem for females, for sure. But again, if you were to, you should probably go see your doctor, because there's a number of medical problems that can cause hair loss, including thyroid disorders. There's a lot of autoimmune disorders. There's medications. I know the antidepressants, the SSRIs can cause hair loss, birth control pill, and a long list of medical problems, medication, and other skin conditions that can cause hair loss. So the first thing I do with a young female is make sure that they've had a full medical workup before you even consider medication. So the first step, I would say, is to visit your doctor. And the other issue is that quite often doctors will kind of, because it's not a real medical problem the way they see it, you really have to sort of push to make sure that you see somebody that has an interest, and even a referral to an endocrinologist, and make sure you get a proper workup for sure.
Would Carla have had to go to a doctor to get a prescription for minoxidil in the first place?
You can get 2% over the counter. To get the 5 or 6%, you need to visit a physician.
All right.